right, greetings, team, and welcome to today's episode where we're going to talk about breast cancer. It's being October and being the Breast Cancer Awareness Month, we need to understand a little bit of it so that we can also know how to intervene in case maybe our relatives or our friends are confirmed or suspected to be having breast cancer. So we know that it affects both males and females. The proportions are different because of the differences in the structure of the breasts between the female and the males, where we have a lot of cases happening in the females and very few cases happening in males. Breast cancer is mostly hormone-driven. It's mostly because of different hormones that control the process of milk production, the process of usual female reproduction. But during different conditions, we have overexpression of these particular hormone receptors in the breast tissue, and we could have complications or problems in the ducts that are draining the milk. We could have issues with the glands themselves or the lobes that are surrounding those particular that are within the breast tissue, and we could have also issues in the fibers, the muscles themselves, the muscle tissue of the breast itself. Now, those are different areas that could be affected, and they are the ones that are primarily targeted in the diagnostics for the breast cancer. Now, what can be done, or maybe how can you know that you are having breast cancer, and how can we be able to suspect? Usually it manifests as a lump. You can be able to feel some sort of a swelling in the breast when you do a physical examination at home. You may feel a lump, and you might want to know what kind of a lump this one is. And you might want to do screening tests, like after the physical examination. Then you can do imaging. You can go for an ultrasound of the breast or a mammography, which is just an advanced form of ultrasound, if I can be able to put it like that, so that the swelling can be further described. If it is a lump, if it is just a cyst or a sac that is filled with fluid, or it's actually another growth within the muscle of the breast tissue. So those are things that can be checked on in the imaging, and when it is confirmed that it's a lump that's growing, and then a little bit of that tissue or that section of the lump can be taken so that it can be analyzed in the laboratory, in the pathology laboratory, to determine if this kind of growth is just restricted to the breast, or it has been able to spread to other tissues or other places, which could include maybe the liver. It can even include the brain or lymph nodes, those lymph nodes that are adjacent, especially in the armpits, because they are connected to the breast, and they also have the lymph drainage system connecting the two. So it's very, very common to find that the breast cancer spreading to the armpits first. That's why it's important to examine to see the extent to which that particular issue has spread. Now, after determining the nature of these particular growths, after determining whether they are cancerous or they are just benign within the local tissues of the breast, now that's where the interventions can be able to come in. If you've determined that they're just benign, then these tissues can be removed surgically, and then you will not have a problem. If they have been able to spread elsewhere, then you could be able to remove the tissue itself together with the accompanying lymph nodes that are affected, the sentinel lymph nodes, they're called like that. And then now be back to normal health, like the way you were before. If these growths are involving a large portion of the breast, sometimes all breasts can be removed in a procedure called mastectomy. Or if both breasts are involved, then both breasts can be removed and then maybe probably be replaced by some kind of an implant so that you may maintain the structure, the normal body structure. So it's very important to know how these lumps could be able to feel. You can be able to do this at home, and then after you've been able to do those particular physical examinations yourself, then see a lump, and then you can be able to visit a healthcare provider near you, let them do an ultrasound for you, and then from the ultrasound, it can be able to inform further measures like the pathological examinations in the laboratory, so that now we may know how to intervene fully. It may also involve treatment through chemotherapy or hormonal therapy and all those kinds of things, depending on how the laboratory has been able to determine the nature and the characteristics of this particular growth in the breasts. So I wish you a happy month. I wish you good moments as we reflect on this, and even as we empower each other, empower people in the communities to be able to be vigilant, pick up these issues very fast, so that the earlier the issues are picked, and then it's very easy to intervene. But most of the times we leave these conditions until they are excessively grown, and it becomes very difficult to control when it comes to those particular advanced stages of these particular cancers. So the earlier they are detected, the better the outcomes from the interventions done. So thank you so much, and see you in the next video. Bye-bye.